Hey guys, like many major cities, Chicago has a health equity problem. Where you live directly impacts your health. The local clinic is focused on improving some of those outcomes.
Here in Chicago, your zip code often determines your lifespan, which is quite scary.
Streeterville and Inglewood are separated by roughly 10 miles, but that distance also represents the largest life expectancy gap in the entire country. A study by NYU Langone shows people who live in Streeterville live 30 years longer than someone who calls Inglewood home. There's a long list of reasons of why that gap exists. Lack of access to adequate health care, and even if there is access, oftentimes it's hard to find a doctor that cares.
It's unfortunate that they exist. Those type of doctors that actually all they do is write a script, and that's all they want is that money from Medicaid. They don't have any personal rapport, or they don't have any type of relationship with the patient.
So let's start with the 1 o'clock patient. No blood work needed. It looks like they've already had that.
Building that ground level of trust is step number one for Dr. Rene Roberts and the team at Oak Street Health.
The doctor-patient relationship cannot exist if we're not first building good trust. I always tell my patients, I'm going to treat you as though you were my own family member, my own mother or father. I want to see the patient as a person first, more so than just a list of diagnoses or medications that they're taking.
Most of the clinics at Oak Street are located in communities of color, where the problems are often bigger than the lack of access to adequate health care. A lot of these issues when you see your patients, I'm sure, kind of starts with their diets.
Yes. You know, we have a lot of our centers are located in areas where there's a food desert. So a lot of patients are struggling to find access to clean water, a grocery store that actually has fresh produce, fruits, vegetables. You know, those are the building blocks of a healthy lifestyle, and it makes it a lot more challenging for our patients to eat healthy if they don't have access to that.
And tackling this issue of racial equity in healthcare is bigger than just one single clinic. Dr. Roberts tells me she understands why some communities just don't trust the healthcare system, but whether they go to Oak Street Health or somewhere else, she says if you don't see a doctor, it's harder for them to help you. Now, the city of Chicago is also addressing this issue through its Health Chicago 2025 plan. For more details, check out this story on fox32chicago.com. And that plan by Chicago Anthony also acknowledges some of the systems and policies that contribute to this large life expectancy gap.
All right. Thank you for highlighting that important issue here locally. Brian Jackson, thank you.